After the history and physical, the clinician has some idea about the patient's possible diagnosis. This is called the clinical impression. Now it's time to obtain more clinical data. Orders are written for the patient. The medical staff specifies who can write orders. Who are allowed to write orders? Always physicians, and in some states, nurse practitioners and physician assistants. Orders are written for lab tests. Hematology tests are common. They're also called complete blood counts or CBCs. Hematology or complete blood counts are common. They show the numbers of each type of blood cell, the hemoglobin levels, and information about cell sizes. Blood chemistry tests are also common. They show how well the patient's organs are working. Common measurements are for sodium, potassium, glucose, cholesterol, and other elements. Another name for these tests is profiles. The urinalysis test is an examination of the urine which gives more information about kidney function and some diseases such as diabetes and infection. Orders are also written for imaging tests. These let us see inside the patient's body. Imaging tests include X-rays, ultrasounds, computed tomography or CT scans, magnetic resonance imaging or MRIs. Still more orders might be written for tracings. Tracings look at the electrical activity in the patient's body. Common tracing tests include electrocardiograms of the heart, abbreviated also as ECG or EKG, and uterine contractions and fetal heart monitoring during labor when a woman comes in to deliver a baby. Orders are also written for medications. This is an example of a medication order, Lasix, 80 milligrams IV now. If we look at the order, Lasix is the medication name, 80 milligrams is the dose, IV is the abbreviation for intravenous, which is the route into the body, and now is when the medication is to be given. Medication orders require all of these elements. Orders are also written for therapy, surgical procedures, and consultations. A consultation is asking another physician to see the patient, review the record, and write an opinion on what to do for the patient. All orders must be entered in the medical record and signed by the person who wrote the order. Please be sure to read about verbal and phone orders on page 112 in the textbook. Also read about special orders on page 112 through 113 in the textbook.